Hi, this is Jessica DeMassa reporting from HIC 2017 at the HISA studio. I'm here with Mark. Mark, can you please introduce yourself?
Mark Moroli, HISA member, certified health informatician, one of the cheers here at HISA. I'm a physical therapist or physiotherapist, also a health informatician, have a PhD in health informatics, and probably work more in research and academic institutions at the moment. So that's my story.
Okay, so tell me a little bit about what's going on as far as health informatics is concerned in academia. What are you guys studying?
Look, I think we've had reasonably well-established health informatics programs, in particular at sort of a postgraduate level, at least sort of for the last sort of 10, 12 years, working in sort of the general sort of health informatics, bioinformatics sort of space. Probably the main thing that's started to happen in the last few years is a bit more of a push towards the clinical informatics competencies. So obviously one of the main focuses of the conference is clinical informatics. I'm on the HISA Clinical Informatics Leadership Network. Okay. Really what we're trying to do is pioneer health informatics in the hospitals, in clinical roles. Trying to champion the Chief Clinical Informatics Officer role. So from an education perspective, we sort of have limited courses that are quite focused on clinical informatics. However, that is changing. I was working and convening one particular unit at the University of Melbourne, which is probably the only course specifically on clinical informatics. And we sort of try to take our lessons probably from the States and Canada, who are a bit more established in the tertiary space in health informatics degrees and courses. I'm now working in the undergraduate space, which is actually a really unique and exciting opportunity to be working in because we don't have a lot of formal informatics programs at a bachelor's level, or when I say at a bachelor's level, school leavers and entry level. So one of the big things we're trying to do is ensure that, say, health science students or students that are going into an undergrad curriculum in nursing or allied health, medicine, are covering those core competencies in informatics. And I think obviously one of the big things in Australia that we're going to see really shortly is the push towards a formal accreditation framework in informatics, which we've been lacking in Australia for a long time. So that's probably the, I think, most exciting and biggest push.
What are some of the things that your students are learning? Like what are you teaching in these classes? I mean, in terms of some of the bigger themes.
Look, I think the way that a lot of the Australian informatics programs are trying to structure themselves is probably, I guess the best lessons we can take are from maybe the CHIA program. So obviously the CHIA program through HISA, I'm not sure if you've spoken to any other CHIAs.
I have not.
But essentially CHIA is sort of built on the core competencies of health and biomedical informatics. A lot of our education programs are trying to model off those competencies. So when you ask what are we teaching the students in informatics, it's everything from information systems, health information systems, IT at various levels, computing, health science. Okay. So understanding sort of the basis of health and wellness and disease, pathology, how the health system works, etc. We teach students a lot about the socio-technical competencies in the sense that we're not just dealing with health, we're not just dealing with technology, but there are people behind all of that. Sure. I think informatics has also got a really strong component of management skills, project management, organisational change, people and culture, that type of thing. So I think that's probably the sort of the main things, as well as obviously core theories in informatics, sure, etc.
And so, Mark, last question for you. Yeah. So these students that they come out of the program and after being formally taught about informatics in a very structured way, what can the health industry expect from these people as they come out of school and then they start to make their way into career paths in hospitals and in the health system?
Well, I think a big part of the work that HISA is doing and that we're trying to pioneer with informatics in Australia is obviously more formally recognised titles and credentials in health informatics. Mm-hmm. Part of the difficulty with sort of school leavers and people studying digital health and e-health is that it's still quite hard to find job roles specifically titled as health informatician. So a lot of the job roles that students tend to go into are as associates or analysts. At the same time, it also depends on what the core focus of the area of study is. Sure. So we could actually have students in IT that are going into health, or health vice versa going into IT. So I mean, if you're coming, say, let's say from an information systems, computer science, IT background, essentially students working on sort of new hospital systems, cloud technologies, cybersecurity jobs are a very big job role at the moment. Whereas obviously if you're coming from a health background, it could be anything from, again, roles as Chief Clinical Informatics Officer, which we really want to see happen. That's part of the clinical informatics work. And it could also just be being a digitally savvy clinician who understands the ins and outs of working with medical records and hospital decision support systems. So, yeah, we're sort of a long way away, but we're getting a lot closer. So
Well, the future sounds bright, and it's wonderful that you're doing your part to help kind of bring this about and, start with the students in terms of, at the bachelor's level even, educating them on
no,
this.
that's something I want to see more and more of, especially at that undergrad level, and hopefully can make that happen.
Wonderful. Well, best of luck to you. Thank you so much for joining us here in the HISA studio here at HIC 2017. Thank you.